for everybody. So I'm Dr. Rob Sickler, I'm the anesthesiologist here, just talking about LMAs. There's a couple of them. It's two brands basically. There's the eye gels, which we have in the ORs. I've just learned that they're in the difficult airway kit. And then every code cart is going to have one of these unique LMAs. So they look like this, and we can go over kind of both of them and the differences. But they are all color coded, so you can see each size is different. The weights are here, so you can look in kilograms. This one's 50 to 70, and you can look on the packaging and choose the appropriate one for the patient. It's usually a good rough guide. It's not absolute by any means. If they have a really small mouth, you can go down a size. If they're really big, you can go up a size. Other things you'll need is just a little bit of lubricant, so you can put a little bit just on the back here. That'll help it slide in, or else it'll usually get caught up in the mouth. Some things you can use is a tongue depressor to kind of put the tongue down and get it out of your way while you're putting it in there if you're having difficulty. And usually that's about it for what you need. These unique LMAs, they need a syringe, so they'll need a little bit of air sometimes to seat properly, so you might need like a 20 cc syringe as well. The only other differences between these two, so with the unique LMA, like I said, there's a kind of an inflatable cuff that that'll need to be inflated or deflated based on the patient and getting a good seal. These don't need any inflation at all. They have some sort of fancy plastic that kind of, once it gets heated up by body heat, it'll start molding to the airway, and then that usually gets you a seal within a couple minutes. And otherwise, that's kind of the two major differences. Just placing them, or I guess circling back, these are great adjuncts for difficult airways, particularly is probably when you're going to use it the most. They do a good job at protecting the airway from secretions and things like that, but they're not the 100% like an endotracheal tube would be. You have to keep that in mind. So there's still possibility for gastric secretions or anything like that to come in through and around that. So obviously, if you have a choice to put in a ET tube, that's probably the best thing. But like I said, the most common time you'd probably be using this is a difficult airway. So let's say you're having difficulty ventilating, you're tried a couple intubation attempts, and you're not being able to get the cords. You can usually pop one of these in, and a lot of the times this will save your butt, which is very exciting. In a high stress situation like that. So I've definitely seen them used before to rescue or help with a difficult airway. So placing them, it's not too complicated. The thing you want to do is one, select the appropriate size like we talked about. Then two, you're going to want to put a little bit of lubricant on top. So just squirt just like a little bit on the top. You can use a finger or just rub it anywhere to get just a thin film. I've used this for the mannequin, the little mineral stuff. Then other than that, when you're at the top of the bed, you're just going to want to scissor open. And then you can either kind of just hold it like a pencil like this. Some people will kind of hold it like that with their finger kind of at the back here. There's a couple different ways, whatever's comfortable or seems to be most effective for you. And then you just want to start inserting it kind of over the top of the hard palate. You'll price it and start advancing it down into the back of the airway. So just keep on advancing. You want to get past the tongue, and then you'll just start feeling some gentle resistance kind of around this area here. That's when it's seated correctly, and then you'll hook up to a bag mask valve or whatever else you're using to ventilate, and then you'll check to see if you're getting some fog, making sure you don't hear for a leak, making sure if you use end tidal, you can double check with end tidal. Look for chest rise, all that, the same stuff you would do for bagging or intubation or anything like that. If you do hear a leak, you can adjust it, you can kind of push it in a little bit more. A lot of times you just need to seat it a little bit more. For the unique LMAs, you can add a little bit more or take out a little bit of air with the syringe as well, and then that'll help get a better seal. The common problems kind of getting this in here, a lot of times they'll just get caught up on the tongue. That's usually the biggest culprit, so they'll be kind of somewhere half in, and then you just can't advance it anymore. That's a good time to use your tongue depressor. So like I said, you can kind of just use that to kind of push the tongue out of the way, and then that usually helps. A couple other tricks you can do is sometimes I've seen it inserted upside down, and then that kind of pushes the tongue a little bit, and then you can kind of rotate as you go. Sometimes that's helpful. You can use your fingers if you really feel like you need to, but do that at your own risk. I wouldn't recommend it. You don't want to lose any digits. Those are usually kind of the common maneuvers to be able to get at the seat and get past that a little bit better. Like I said, a lot of the times it's just hard because you're doing this blind, so you don't see it exactly where you're seated. You just have to go by feel and then double check to see you're getting a good seal. I think that's it. A word of caution for, don't jam it in there. You can cause trauma. I've seen people blooding up the airway with these too, just like any other device. So don't go wild. You should be a gentle amount of pressure. It shouldn't be anything extremely forceful, because if you start causing bleeding in the airway, then that's going to make things worse. I think that's it. Anybody have any questions right now, or?
So for the other
unique,
element,
yeah.
the unique element.
Yeah.
Now we always learn to deflate the